Syria's protracted crisis has taken a devastating toll on its public healthcare sector. Hospitals across the northwest are struggling to stay open as international aid dries up, leaving patients and health workers struggling.
I came here to get treatment for injuries I suffered at work. Without these hospitals, we would not be able to access medical treatment. Things would get much worse because not everyone can afford private healthcare.
Medical teams say they are stretched to breaking point, operating without essential supplies, while demand for treatment continues to rise.
We are facing many challenges in the region, including the massive destruction of infrastructure in several areas and the suspension of the funds for many healthcare facilities and hospitals. We have worked on restoring some of these facilities, and we are now focusing on maintaining the operations of those that remain.
For displaced families still living in camps, hospitals like Bab al-Hawa remain the most important lifeline.
Bab al-Hawa Hospital is one of the most important hospitals in the region. We serve up to 16,000 individuals every month and provide more than 31 different medical services. Many of the services are only available here in all of the northwest Syria. The cut in funding will cause a humanitarian crisis as people simply have no other option.
Yet only a fraction of Syria's destroyed healthcare system has been restored, leaving vast areas without functioning medical services. According to government estimates, nearly 40% of the country's healthcare infrastructure was destroyed in the conflict. What makes the task even harder for the new Syrian leadership is that its foundations for rebuilding are in areas that suffered multiple humanitarian crises and which are financially exhausted. The Syrian government says despite these challenges, they are doing everything possible to keep hospitals operative.
We are working at full capacity despite the funding cuts. We lack many of the essential logistics needed for our section to operate. The hospital continues to serve large numbers of people from the community as well as residents from nearby refugee camps.
Syrians warn that without urgent international support, healthcare could collapse further, and they hope that after 14 years of suffering, they can finally find stability. Nour Qormosh, TRT World, Idlib, northern Syria.